on the 10th of December. Her hand accidentally got entrapped in the lift at around 1 p.m. and she arrived within half an hour of the accident. That is one thing was very which made our thing very successful. Her hand was amputated at the level of the wrist, and she was bleeding from the amputation stump, but she was conscious and she was cooperative. The arm which was cut, it was brought in a plastic bag which was put in a thermo-coil box filled with ice pieces and ice packs. At our casualty, she was resuscitated and stabilized, and a dressing was done for her. The cut hand was sent to the operation theatre immediately for starting the surgery. So on arrival at 1:30 and at 2:30 we had already sent the cut hand to the operation theatre for starting the surgery, and I started the surgery on it at around 2:30. Then she was brought to the operation theatre around 3:30, and the surgery was started. We gave her general anesthesia, and her bone was fixed first. Then I fixed the veins, the artery, the nerve, muscles and the tendons, and we could complete the surgery in around 8 hours. We could re-establish the blood flow to the cut hand within 6 hours of amputation. This is a photograph of how the hand was brought to us, relatives, and I'm very thankful to them. How fast should the amputated part be replanted? If the cut part has not been stored properly, then below the wrist it should be replanted within 16 hours. Above the wrist level, if the hand is cut, then it should be replanted within 6 hours. This is important. And if the cut part has been stored well, as I have described earlier, then it can be replanted within 12 hours also and 24 to 30 hours respectively. On arrival at the hospital, this is what we need to do. We need to inform the replantation center early so that the team is ready. The plastic surgeon, orthopedic surgeon, anesthetists need to be ready. The OT has to be arranged. Blood samples have to be sent. The patient has to be resuscitated. Any other life-threatening condition to be ruled out. Then the patient to be sent to the operation theatre as early as possible. Then the attendants have to be counseled about the surgery, and ICU setup has to be made sure is available. Post-op care for the patient is important, which requires hydration, pain relief, and keeping the patient warm. These are the few factors which make a difference for a successful replantation. One of the main predictive factors are the time of presentation. The earlier the patient presents, the more the chances of success. Then the preservation method, how the cut part has been preserved, that also makes a very big difference. Then another part is the injury mechanism. If it is a crush injury, the chances are bad, and if it is a clean cut injury, the chances of success of the replantation is high. Then the level of amputation. If the cut or the amputation is a little higher up, then the chances of the replantation are not as good. Then there are some technical factors which determine the success, and some medical factors like smoking and use of caffeine and other agents. So with the improvements in microsurgical techniques, replantation of major amputations of the upper extremity has a high success rate of technical success, and in cases where the amputated limb is brought on time and preserved well, the chances of success increase manifold. With a successful replantation, the limb can achieve as high as 50% of the normal function. Revisional surgeries and extensive therapy can improve the functional and aesthetic outcome all the more further. So it's always worthwhile to attempt to replant any amputation at any level. Proper and quick transport of amputated part is the key factor in success of a replantation. A well-equipped OT and a trained medical team is the next important factor. And the functional outcome of amputation is, though unpredictable, but with all these factors taken into consideration, everything is in the ideal thing. We can give an outcome of almost 80 to 90% of success.